This is the second lecture audio of general pathology of cell injury.
The second type of adaptation is the hyperplasia. Hyperplasia is the increase in the number of the cells, which lead to increase in the size of the organ. Usually, it's achieved by production of the new cells by stem cells. It might be physiological. The physiological, as example, when in the female uterus during a pregnancy, hyperplasia is accompanied by hypertrophy. In such case, there are two adaptive processes occurs in the uterus of the female, because in order to withstand the enlargement of the uterus due to the hormonal effect of the pregnancy. Another example of the hyperplasia is in the female breast during puberty or during lactation, in order to withstand or to tolerate the hormonal effect and the stimulus due to, especially during lactation, or preparing the female to lactate after delivery. Other type of the hyperplasia is compensatory type. This is usually occurs when the portion of the tissue removed or diseased. Example for this, when the liver is partially resected, such as there are many cases when the liver is resected, might be in surgical due to the trauma. So there is part of the liver is removed due to the trauma, or sometimes due to any reason. Sometimes patient donate part of his or her liver to her mom or to her dad, because of the for liver transplant. So part of the liver is removed. This donor that undergo partially resected of his liver, there is a mitotic activity. Mitosis increase the activity of the cell to proliferate. It begins as early as 12 hours later after removal of the part of the liver, in order to restore the liver to its normal weight. When this occurs, it occurs within 3 months of resected of the part of the liver. The hyperplasia in this setting, it is due to the stimulation by polypeptide growth factor, which is produced by the remnant or adjacent hepatocytes, that is the normal hepatocyte or the remaining hepatocyte that is not resected, of course, and as well to the non-parenchymal cells found in the liver. You know, there's parenchymal cells in the liver and non-parenchymal cells in the liver. Parenchymal cells mean the functional cells of the liver, which is the function, the liver cell or the hepatocyte that has its own or responsible of the function of the liver, and the non-parenchymal cell with the cells that are present in the connective tissue stroma between the hepatocytes. This is a picture of the uterus. This is a pregnant uterus which weighs 1,000 grams, and this is a normal one which weighs 100 grams. This is a microscopical picture of the uterus of the normal smooth muscle, uterine smooth muscle cell, comparing to the large, plumpy, hypertrophied smooth muscle from a gravid uterus. Gravid uterus means the uterus of the pregnant female. Pathological, due to the abnormal hormonal stimulation. Actually, it is not due to the physiological normal hormonal stimulation. This is due to the hormonal stimulation, as in the endometrial hyperplasia, especially in the perimenopausal. That means that especially in the females, perimenopausal, that's about to have to be menopause. So it would be due to the estrogen hormone stimulation or irregular hormonal irregular hormones, which lead to the imbalance of the hormones. This irregularity in the production of hormones lead to the thickening of uterine endometrium, and the clinically patient presented with a dysfunctional uterine bleeding called menorrhagia نزيف. المرأة بهاي الحالة presented with bleeding menorrhagia، يسموها menorrhagia. سبب هذه المينوريجيا it is hormonal imbalance which led to the endometrial hyperplasia, thickening of the endometrium due to the increase in the estrogen hormone production, so it will lead to the thickening and hyperplastic endometrium. In the male, on the other hand, there is benign prostatic hyperplasia, which cause urinary tract symptoms and obstruction due to the prostatic enlargement. The other example is in wound healing. The growth factor stimulated fibroblasts and blood vessel endothelial cell hyperplasia in order to facilitate repair. In this case, the growth factors are produced by the white blood cell that accumulate at the site of injury. This pictures diagrammatic view of the normal uterus. Look at the endometrium. This is the endometrial cavity. This is a fallopian tube. This is a cervix of the uterus, and this is a uterus cervix, and this is a endometrium cervix, and this is a uterus endometrium, and this is a myometrium. Look at here. This is endometrial hyperplasia. Look at the thickening. This is the endometrium, which is thin endometrium here in the normal female. Here we can see thickened of the endometrial due to the endometrial hyperplasia, due to the irregular or hormonal imbalance, due to the excessive estrogen production, which lead to the, in such a case, the female patient presented with the irregular uterine bleeding called menorrhagia. This is a microscopical view of the normal endometrium. I would like you to see and to remember this picture very well, in order, because we are coming to the pictures later on which showing the hyperplastic uterus, in order to compare the normal endometrium with the abnormal looking hyperplastic endometrium. This is the endometrial glands, which are normally found in the, this is endometrial surface epithelium. This is the endometrial gland. Look at a small, smooth, beautiful, arranged cell glands, endometrial glands. Look at the spacing between the glands. This is a stroma, widened stroma in between the glands. This is a beautiful endometrium of the normal female. Here we are coming to the microscopical view of endometrial hyperplasia. This is a view, lower view, and this is the upper. Look at here. This is glands, enlargement of the glands, increase in the number of the glands, decrease the stroma in between the glands. So here is more hyperplastic. This case is more than, maybe this is the same case. No, this is another case, because this endometrium is more hyperplastic than this one, because the glands here, look at the glands, more compact with each other, more close to each other, loss of the stroma in between the glands. If we compare it with the picture in the previous slides of the normal endometrium, you can recognize and you can realize how the hyperplastic endometrium is looking like. This is also more hyperplastic endometrial glands has been here, because there is increase in the number of the glands, decrease in the stroma. The glands become compact with each other. At the same time, there is folding of the glands tortuous of the glands. Look at here, it is more hyperplastic and increase in the number of the glands in the hyperplastic endometrium. This is another picture showing that prostate and urinary bladder. This is a male patient. This is a prostate of the normal patient. This is a urinary bladder, and this is a prostate. The prostate surrounds the prostatic urethra. Here there is a prostate, benign prostatic hyperplasia, lobular or nodular enlargement of the prostate compressing the prostatic urethra. From this picture, you can guess and you can how the patient suffered or how the patient clinically presented to us when patient have prostatic hyperplasia. You can see there's obstruction in the urine, outflow of the urine from the urinary bladder, lead to the retention of the urine here. So the patient have difficulty in urination, might have dysuria, burning sensation of the urine because of the increased incidence of the UTI, and all other feature of urinary tract obstruction, dribbling of the urine. These are the features of the patient with benign prostatic hyperplasia. Mainly those patients are elderly patients. Here is also this picture is another example of benign prostatic hyperplasia. This is a urethra, constricted urethra. So the lumen of the urethra decrease or diminished. So this is another, look at here, gross appearance of the prostatic glands showing benign prostatic hyperplasia. Look at this is a nodular appearance or architecture of the gross appearance of the prostate. This is a microscopical view of the normal prostate. Here, to see that this is a prostatic glands and this is a stroma in between the glands with the muscle. Look at here. It is a microscopical view of the benign prostatic hyperplasia. But if you compare this picture with the picture previous one, you can recognize that the glands are increasing in the size, the stroma between the glands are decreased. These glands are close to each other, compact, increase in the number, become crowded. It is look like a crowded كأنه يعني كيف واحد يمثل لكم إياها كأنه مجموعة من الناس وطالعين على مكان ديت شو بحكي لكم باللغة العربية crowding يعني ناس فوق ناس يعني crowded there because of the increase in the number of the prostatic glands. So there is no space in between them and decrease the amount of the stroma. It's important to note that in both examples of pathologic hyperplasia, the hyperplastic process remained controlled. But if hormonal or growth factor stimulation ends, hyperplasia disappear. Yeah, it will disappear. If the patient with endometrial hyperplasia and the patient coming, the clinical. Now we are coming to the other type of adaptation. It is an atrophy. الاتروفي معناها الضمور، يصغر، يقل، diminished in size. It is decrease in the number of the cell, shrinkage in the size of the cell by the loss of the cell substance. When there is a large number of the cells that are affected, so the entire tissue or organ diminish in size. It becomes atrophic. There are many causes of atrophy. العضو أو التشو يصغر, diminished in size, shrinkage. There are many causes of atrophy. What are the causes of the atrophy? First, decrease in the workload. Workload, that means immobilized muscle in the paralyzed limb. شخص العضو مالته لا يتحرك. Decrease in the workload، ما يشتغل. هذا العضو من ما يشتغل مثلا الشخص صار عنده paralysis hemiplegia. شنو معناها؟ صار عنده شلل في جزء في رجل، عضو في ايد. راح تلاحظون انه هذا العضو الرجل او الايد راح تصغر حجمها. Why? Because it is decrease in the workload. لما تتحرك no work by this organ. Second cause is decrease or inadequate nutrition. There is no nutrition to that organ or tissue, also lead to atrophy. Decrease in the blood supply, as in atherosclerosis. شخص عنده تصلب شرايين. تصلب شرايين يعني الشريان the deposition of the fat or of the lipid material on the substance on the wall of the blood vessels, which lead to the narrowing of the lumen of the blood vessels. من يصير تضيق بالشرايين بسبب تصلب الشرايين بسبب الدهون المتراكمة على الجدار الداخلي للشريان. It will lead to the atherosclerosis. Atherosclerosis من يصير عندنا narrowing of the blood vessel as a result of the deposition of this lipid material or substance. It will lead to the decrease in the blood flow to the organ. What will lead? It will lead to the atrophy. طبعا لأن كل blood vessels there is supply blood supply an organ. من supply an organ يقلل blood supply to that organ فحيقل decrease to the blood supply to that organ will lead to the atrophy of that part of the body. Aging العجز أو الكبر أيضا يؤدي إلى الضمور. Loss of endocrine stimulation, loss of hormones, also one of the factors that lead to atrophy. And denervation, loss of that nerve supply. When there is no nerve supply to the organ or tissue, it will lead to the atrophy. So those are the causes of atrophy. Loss of the cell may occur in apoptosis. What is apoptosis? Apoptosis, we are coming in next lectures to the full discussion and full of the apoptosis. It is a special type of cell death. Also decrease the number of the cell of the tissue and organ by this type of death via ubiquitin and proteasome pathway. Nutrient deficiency and disuse of the organ or nutrient deficiency, when there is decrease or there is decrease in the blood supply, lead to the activation of certain pathway of the body. It is called ubiquitin ligases enzyme. What are these enzymes? These enzymes enhance attachment of multiple copies of small peptide ubiquitin molecule to the cellular protein as the cellular intermediate filaments of cytoskeleton and target them to gradation by proteasomes. لما العضو لا يستخدم disuse أو there is deficiency in the nutrient لفترة طويلة, paralyzed organ, decrease in the blood supply, whatever the cause that lead to the immobilization of that organ or tissue, or it will lead to activation of ubiquitin ligase enzyme. What are these? These increase the attachment of the peptide ubiquitin molecule to the protein as cellular intermediate filament of the cytoskeleton, make them the protein make them degrade by proteasome. كأنه تخلي لها كود للبروتين in order to be attacked or to be targeted by proteasome to degrade them. فمن احنا قلنا من يصير عندنا hypertrophy يصير increase in the protein, cellular protein. هنايا in atrophy decrease because one of the causes of the loss of the cell is the activation of ubiquitin ligase enzyme, which increase or enhance the attachment of the peptide ubiquitin molecule to the protein, which lead to be targeted, to be degraded by the proteasomes. The third one is the cell may undergo autophagocytosis. What does that mean? The phagocytosis of the cellular component, which involve generation of autophagic vacuole that fuse with the lysosome, whose hydrolytic enzyme break down cellular component. اللي يصير autophagocytosis يعني تاكل نفسها الخلايا. Autophagocytosis. It's a generation of autophagic vacuole, فجوة that fuse with a lysosome وبها hydrolytic enzyme which lead to the break down of the cellular component, so it will lead to decrease and loss of the cell. Those are the conditions or the situation when the loss of the cell may occurs. Here we are coming to the normal young adult brain. This is a normal. Look at the sulci and gyri of the brain. And look at here, at the brain of the patient, 82 years old, with atherosclerosis. Atherosclerosis, as we discussed in the previous slides, it is تصلب الشرايين when there is decrease in the diminish in the blood supply to the organ. One of the organ is the brain, would lead to the loss of brain substance because of the agent and decrease of blood supply. It will lead to the narrowing of the gyri, decrease because of the decrease of the brain substance, and widening of the sulci. تصير أعرض. Look at here, when you compare it with the normal brain, you will see the difference in between. The sulci is widened while the gyri is narrowed, while here is the normal. There is another example of the atrophy. This is a black arrow when there is loss of the nerve supply as in the paralysis, comparing with the leg of the normal leg, and this is paralyzed patient because of the loss of the nerve supply, so decrease in the size of the leg. Look at here, when there is atrophy of skeletal muscle fiber due to the denervation, loss of the nerve supply, comparing with the normal skeletal muscle fiber, which is seen in both sides. Here there is atrophic muscle fibers because of the loss of the nerve supply. Now we are coming to the other type of the adaptation. It is a metaplasia. Metaplasia meaning it is reversible changes, mean that when the stimulus or the cause of this metaplastic changes cease or end, the type of the cell change or return back to normal. Yes, it is reversible changes. This reversible changes in which one adult type, epithelial or mesenchymal, is replaced by another adult type. The cells sensitive to a particular stress are replaced by other type of the cell, better able to withstand the adverse environment. This arises by the genetic reprogramming of the epithelial reserve stem cell. As examples, when there is squamous, first one is a squamous metaplasia. When could we see, or when should we see the squamous metaplasia? Squamous metaplasia may occur in the respiratory epithelium. The main or the important example of this in in cigarette smoker people or person. When there's normal ciliated columnar epithelium, the lining of the respiratory tract, of the lining of the trachea or bronchi, these are the normal respiratory or the normal ciliated columnar epithelium replaced by squamous epithelium. It's called squamous metaplasia due to the irritant effect of the cigarette smoke. So these ciliated columnar epithelial cell replaced by stratified squamous epithelial cells in order to combat and withstand this abnormal environment or adverse environment that caused by the irritant effect or the toxic effect of the cigarette. Another example that have the same or induce the same changes is in the vitamin A deficiency. In the respiratory tract, the metablastic changes seen among smokers. So be careful. The smoke is not good for you. And I know that many of you, not all of you of course, but many of you are smokers or smoke ergela. Anyway, it's not good for you. You are still young and still your trachea and bronchi and respiratory tract organs are still healthy. So be careful. If any one of you smoke, please stop smoking because you will see what will happen to your respiratory tract. This metaplastic changes, these changes that among the smoker is beneficial as presumably the more become the cells, stratified squamous epithelium become more resistant and can withstand this the adverse environment of the smoke. But does that mean this is a good process? No, it's not good process because the changes of the normal epithelium from the ciliated columnar epithelium to stratified squamous epithelium, however, it sounds that it is more resistant, but it will lead to the loss of the mucus secretion and ciliary clearance of the normal respiratory epithelium. However, this squamous epithelium is more resistant to the smoke toxic effect of the smoke and irritant effect of this smoke, and has probably has survival advantage, but have disadvantage that it will lose the mucus secretion, which is very important to get rid of the any foreign material or foreign particles that you may inhale, and the ciliary clearance of the particulate matter. At the same time, this metaplastic epithelium, if the toxic effect of the smoke, and of course associated with certain genetic factors, or the cellular changes, it might lead to the dysplasia and later on to the neoplasia or cancer. Does that mean the metaplasia? One of you asked me, is metaplastic epithelium cancerous? It is not cancer. It is not cancer. Does metaplasia or metaplastic epithelium might lead to cancer? Yes. Might change into other type of the cell, which called dysplastic cells, abnormal looking cells, neoplastic cells, and might lead to the neoplasia. But by itself, it is not cancer, but because it is change of the adult type of cell into another adult type in order to withstand and tolerate the toxic effect or adverse environment of the stressful injurious agent that might lead to this meta. Metaplasia of the normal columnar lift. Look at here. Look, this is a normal column. This is a basement membrane. Look at this illustration. Normal basement membrane. This is a normal, beautiful columnar epithelium, ciliated. Look at the cilia. This is a metaplastic. Look at this. تصير خلايا squamous epithelial cell حرشفية. ليش تتحول؟ لأنها أقوى. لأنها ممكن تتحمل التوكسيك افكت اوف ذا سموك، irritant افكت اوف ذا تتحمله. هذه ما تتحمله. اولا السيليا كلها تروح السيليا، بعدين راحت السيليا راحت الميوكس برودكشن اوف ذا فتغيرت الخلايا. لكن هل this is a metaplastic cell change from this type of cell into this type of the cell. This is a cell microscopically. Look at this. Look at this. This is a cilia. This is a columnar epithelial cell. This is a basement membrane. Look at the thin line, thickened line of the basement membrane. This is a squamous epithelial cell. I think you took it last year in histology. This is another microscopical view of the bronchial epithelium, which showing metaplastic squamous epithelial cell. We are still in the normal range of the epithelium. It's not, we are not dealing with the dysplasia, or not dealing. We are still dealing with the adaptive process of the body or of the cell that changing itself into another type in order to adapt, in order to withstand the adverse environment. There is a chronic irritation sometimes. The other example of the metaplasia in patient with bilharzial ova, schistosomiasis, may cause squamous metaplasia in the bladder epithelium. It will be changed the type of the cell, or the type of the lining epithelium of the urothelium of the urinary bladder and renal pelvis, and also gallbladder. So it will lead to the also one of the causes of the squamous metaplasia is the bilharzal ovum or stone in the gallbladder. Now I'm coming to another example of the metaplasia in patient with a chronic gastric reflux. Patient presented with acidity, mean there's reflux of the acid, gastric acid from the stomach to the esophagus. This is it's called GERD, gastroesophageal reflux disease. During this regurgitation of the acid gastric content to the esophagus, normally the epithelial lining of the esophagus is squamous epithelium. When there is abnormal reflex of the gastric acid from the stomach to the esophagus, it will go to this esophagus. So there would be metaplastic transformation of this squamous epithelium into the glandular type or intestinal type columnar epithelium, and it is called the mucous metaplasia. Sometimes this type of the metaplasia called Barrett's esophagus, which might lead to the predisposed to the peptic ulcer, or even sometimes to the adenocarcinoma of the esophagus. This is a Barrett esophagus. Look at here. It is endoscopical view. This is the endoscopical view of the esophagus. Show the changes of the normal squamous epithelium. This is a normal squamous epithelium of the esophagus. When there is acid, when there is chronic reflux of the acid in patient with GERD, you will hear this term, a clinical term, gastroesophageal reflux disease. In your clinical practice, patient coming to you in the clinic or in the emergency room say that I have acidity, heartburn. It is heartburn, حموضة، عندي حموضة مستمرة، وهذه الحموضة مثلا it's been about مثلا 2 years, 3 years. When you examine the patient by the endoscopy, you find that this gastric reflex cause changes of the epithelial cell from the squamous epithelial cell into the mucus secreting. So the lower end of the esophagus become metaplastic, the lining of this become metaplastic, and this type of this called mucus secreting epithelial cell. Here we are coming to the Barrett esophagus. mucus metaplasia. Look at here, this is squamous epithelium, and look at mucus metaplasia. It's converted from the squamous epithelium into the type of the epithelium to produce mucus. In order what? In order to withstand and to tolerate the sharp or the very the acid the very bad effect of the regurgitation of the acid contained of the stomach into the esophagus. This is also microscopical view of the bird esophagus, showing metaplasia of the esophageal squamous epithelia into the mucus secreting. This is mucus secreting columnar epithelium. This is squamous epithelium change into the mucus secreting columnar epithelium. Metaplasia may also occur in the mesenchymal cell. The mesenchyma, what are the mesenchyma? Mesenchymal cells that are the connective tissue cell, the cartilage, the bone, the muscles. At the site of injury to soft tissue and the skeletal or even sometimes smooth muscle, bone, cartilage. Bone is occasionally formed in soft tissue, so-called ossification. Sometimes when the soft tissue there is no bone, but when there is bony tissue, bone is formed inside the soft tissue, it's called ossification. Sometimes this happens when there is injury to the skeletal muscle. It leads to the tumor-like swelling at the site of injury called myositis ossificans. This is tumor-like swelling in the skeletal muscle after the injury caused by the ossification or myositis ossificans, bone inside the skeletal muscle. This is also the same X-ray appearance of the arm, showing myositis ossificans, or there is ossification due to the injury to the skeletal muscle or to the muscle, cause development of the bone or formation of the bone inside the muscle. Here, myositis ossificans, mesenchymal metaplasia in skeletal, showing cartilage, causing cartilage. This changes mesenchymal and bone in the left due to the injury, bone and cartilage. Normal red, this is skeletal muscle, on the right, this is a skeletal muscle, and this is cartilage and bone component that formed specule of the bones. This is a red one, and the cartilage, this is a cartilage. This is mesenchymal metaplasia in the skeletal muscle due to the injury or trauma to the Thank you very much. This is the end of the second lecture of the pathology. I hope you enjoy it. Any question, you can refer to me or ask me during the live session that would be at the end of this week. Thank you very much.